Assalamu alaikum. Welcome all to the Human Anatomy channel. This is another podcast, upper limb bones, humerus. What type of bone is humerus? Where is it located? It is a typical long bone. It is the bone of the arm. What are the parts of humerus? Upper end, shaft, and lower end. How will you determine the size of humerus? The upper end having rounded head which is directed upward, forward and medially. Head is directed medially and upward. Intertubercular sulcus directed anteriorly. Olecranon fossa face posteriorly. Describe the upper end of the humerus. Upper end consists of head, anatomical neck, gaiter and lesser tubercle, intertubercular sulcus and surgical neck. Head is round convex articular surface which articulates with granite cavity to form the shoulder joint, the ball and socket variety of synovial joint. Anatomical neck is present at the junction of the head and rest of the part of upper end. And lesser tubercle, it's present on the anterior aspect of upper end. Gaiter tubercle is situated in the anterolateral aspect. And in between gaiter and lesser tubercle, this is the location of the bicipital group or intertubercular sulcus. The surgical neck is situated at the junction of upper end with the shaft. Describe the lower end of the humerus. Lower end consists of articular and non-articular part. Articular part contain rounded capitulum which is placed laterally and pulley-like structure trochlea which articulates with ulna. Capitulum articulate with radius. Non-articular part, medial and lateral epicondyle. Radial fossa above the capitulum. Coronoid fossa above the trochlea. Olecranon fossa is a big fossa on the posterior surface. Describe the general feature of the shaft of the humerus. Shaft of the humerus is cylindrical in upper half and triangular in lower half. It has three border, three surface. Anterior border, medial border, lateral border, surface, anteromedial surface, anterolateral surface and posterior surface. Anterior surface is continuation of the lateral lip of the bicipital group. Medial border, medial lip of the bicipital group continue downward as a medial border which then continue as medial supracondylar ridge. Lateral border is well defined only in the lower half, continues downward as the lateral supracondylar ridge. Anteromedial surface is situated between anterior medial border. Anterolateral is situated between anterior and lateral border, and just above the middle show V-shaped tuberosity called deltoid tuberosity. Posterior surface at the middle 1/3 show a shallow groove called the radial groove. Deltoid tuberosity is attached with the insertion of the deltoid muscle, and radial groove is contained the radial nerve and profunda brachii artery. The muscle attached to the upper end of the humerus. Subscapularis on the lesser tubercle. Supraspinatus, infraspinatus, teres minor on the gaiter tubercle from above downward. Pectoralis major on the lateral lip of the bicipital group. Teres major, pectoralis major on the lateral lip of the bicipital group and teres major on the medial lip of the bicipital group. and floor of the bicipital group is attached with the latissimus dorsi. Name the muscle attached on the shaft of the humerus. Anterior aspect. Coracobrachialis on the middle of the medial border. Deltoid on the deltoid tuberosity on the lateral aspect. Brachialis anteromedial and anterolateral surface of the lower half of the humerus. Ponator teres on the lower part of the medial supracondylar ridge. Brachioradialis on the upper two-thirds of the lateral supracondylar ridge. Extensor carpi radialis longer on the lower one-third of the lateral supracondylar ridge. Muscle attached on the lower end. Superficial flexure of the forearm on the anterior surface of the medial epicondyle. Superficial extensor of the forearm on the lateral epicondyle. Anconeus on the posterior surface of the lateral epicondyle. Name the ligament attached to the humerus. Upper end, coracohumeral ligament, transverse humeral ligament. Lower end, radial and ulnar collateral ligament attached to the lateral and medial epicondyle respectively. Name the nerve and vessel closely related to the humerus which may get injured during fracture of different part of humerus. Axillary nerve and posterior circumflex humeral vessel to surgical net of humerus. Radial nerve and Procanthopaki artery to the radial group. Ulnar nerve posterior to the medial epicondyle and in front of the lower part of the humerus, median nerve. What is the growing end of the humerus? How does humerus ossify? The upper end of the humerus is the growing end. The direction of network artery is downward. Primary center of ossification appear in the shaft during 8 weeks of intrauterine lap. Upper end ossify by the 3 and lower end by 4 secondary ossification center. Tell the nerve supply of the shoulder joint. Shoulder gets nerve supply from axillary suprascapular nerve. The attachment of the capsular ligament of the shoulder joint. It is attached along the anatomical neck, offset at the upper end of intertubercular sulcus and infralaterally aspect. Medially it is extend on 1 centimeter or more on the shaft, and this capsule is not continuous, it is gap due to the long head of the biceps brachii at the bicipital group. What are the joints formed by this joint? Shoulder joint in the upper end, ball and socket type of, and elbow joint in the lower part. The articular surface is trochlea and capitulum unite with the trochlear notch of the ulna and head of the radius. It is hinge type of joint. What is carrying angle? In fully extended and supinated hand, the long axis of the humerus from an angle with the long axis of ulna. This angulation is called the carrying angle. It is about 163 degree open on the lateral side. It is less in female than the male due to the wide pelvis present in female. What is rotator cuff? It is a musculotendinous band over the shoulder joint which gives strength and stability to this joint during movement. It is formed by the supraspinatus, infraspinatus, teres minor and subscapularis muscle. The importance of rotator cuff, they reinforce the capsule and provide active support for the shoulder joint during movement. The ossification of the humerus, 1 primary ossification center, 3 secondary ossification center for the upper end, 1 for head, 1 for greater tubercle, 1 for lesser tubercle, and 4 secondary ossification center for the lower end, 1 for lateral epicondyle, 1 for capitulum, one for medial part of the trochlea, one for medial epicondyle. Whether the coronoid, olecranon and radial fossa are intra or extracapsular, all the fossa are intercapsular. What is intertubercular sulcus? In between the two tubercle lies the intertubercular sulcus, which is continuous below with the bicipital group. What is the importance of carrying angle? Due to this carrying angle, the extended forearm will be prevented to come in contact with the thigh. Tell the content of the bicipital group. Long head of the biceps brachii with synovial sheath which extended up to the surgical neck, and ascending branch of the anterior humeral circumflex artery. Clinical anatomy of humerus. Surgical neck fracture. Surgical neck of the humerus is the frequently site of fracture, usually by the direct blow to the area or falling on the outstretched hand. The key neurovascular structure at risk here is the axillary nerve and posterior circumflex artery. Axillary nerve damage will be result in paralysis of the deltoid muscle and teres minor muscle. Both muscle is supplied by the axillary nerve, which is derived from the posterior cord of the brachial plexus. Patient will have difficulty performing abduction of the affected limb. The nerve also innervates the skin over the lower deltoid area, and therefore sensation of this area may be impaired. The mid-shaft fracture. This fracture risks damage to the radial nerve and profunda brachii artery because posterior surface of the shaft of the humerus, middle of the shaft of the humerus contains spiral groove which lodge the radial nerve and profunda brachii artery. Radial nerve innervate the extensor of the wrist, and damage of this nerve, the extensor will be paralyzed. This causes unopposed flexions of the wrist known as the wrist drop. This can also be some sensory loss over the dorsal surface of the hand and proximal end of the lateral 3.5 finger dorsally. Supracondylar fracture. It is a fracture of the distal humerus just above the elbow joint. This fracture is typically transverse or oblique, and the most common mechanism of injury is falling on outstretched hand. It is more common in children than adults. In this type of injury, brachial artery may be damaged either directly or via swelling following the trauma. The resulting ischemia can cause Bachmann ischemic contracture, uncontrolled flexions of the hand, and flexor muscles also became fibrotic and short. There also can be damage to the anterior interosseous nerve, ulnar nerves, or radial nerve. The anterosseous nerve can be tested by asking the patient to make an OK sign, testing for weakness of the flexor pollicis longus. This is all about the podcast about humerus. If you like this postcards, please share this and please subscribe my channel. Thank you for watching.